So this is a contribution from Professor Carrie Cutler, who is a psychologist at Washington State University, in collaboration with Zvia Cooper at UCLA and Dr. Ethan Russo, who we all know. And the article is entitled Acute Effects of Cannabidiol on Anxiety, Stress, and Mood, a double-blind placebo controlled crossover field trial. So this is really cool because a couple years ago, Dr. Russo and Michelle Sexton published an article that described a survey of patients that used CBG, cannabidiol, which we know is non-psychoactive. And so they did a survey to find out why people were using CBG predominant cannabis. So this was actually cannabis strains that were enriched with CBG. And what they found was that people were using CBD predominant products, particularly for anxiety, chronic pain, depression, and insomnia. Most respondents reported greater efficacy of CBG predominant cannabis over conventional pharmacotherapy with benign adverse effect profiles and negligible withdrawal symptoms. So the study, this was back in 2022, established that humans are employing CBG and CBG dominant strains. So now in this paper, so that again, that was 2 years ago in 2022. Now here in 2024, they're publishing a double-blind paper. So this is beautiful how we've taken now botanical medicine, where they've basically queried why are people smoking this, and now they're actually doing a double-blind trial. And I see Jean shaking or nodding his head because this is again how science can help us understand. People are using these strains. What are they using them for, and are they effective? So that's basically what this article points out. It says that CBG is a phytocannabinoid increasing in popularity, with preclinical research indicating it has high anti-anxiety and antidepressant effects. However, there are no published clinical trials to corroborate these findings in humans. The primary objective of this study was to examine acute effects of CBG on anxiety, stress, and mood. Secondary objectives were to examine whether CBD produces subjective drug effects or motor or cognitive impairment, as we know is well documented with things like THC. So a double-blind placebo controlled trial was conducted with 34 healthy adult participants. So this is data in humans. It's always good to see data in humans because we know that data from animals don't always translate to data in humans. They participated in 2 sessions with a 1-week washout period in between via Zoom. In each, they provided ratings of anxiety, stress, and mood, and subjective drug effects prior to the double-blind administration. So when they're doing a double-blind administration, they don't know who's getting the actual drug and who's getting, say, what they call just a placebo, to see if there is just a placebo effect. And these were 20 milligram hemp-derived CBD, CBG or tinctures that were used. The rating was collected after participants ingested the product, so they're taking it orally, and then doing a number of different online surveys and verbal memory test, and also something called the Druid Impairment app, which must be an app for the phone that gives you an indication of your level of impairment. So relative to placebo, there was significant main effect of CBG on the overall reductions of anxiety. So it acted as an anti-anxiety treatment. CBG also enhanced verbal memory relative to placebo. Now, correct me if I'm wrong, Dr. T, but that's something that THC does not do. I think it sends you in the opposite direction, and we know that THC does have this effect on verbal memory. There was no evidence on subjective drug effects or impairment. So this isn't something that's going to keep you from driving a vehicle or keep you, say, from going to work. So there is no subjective drug effects or impairment. CBG may represent a novel option to reduce stress and anxiety in healthy adults. So it's interesting, too, as I scroll down the paper, this kind of goes along what we were talking about in Matthew's story, which is that what they claim, or what they I don't say claim, but maybe what they're pointing to is that these compounds are known to act on the 5-HT receptors, which are the same receptors that psilocybin and other psychedelics are acting on. And there didn't seem to be any long-term damaging effects. So Matthew, I think if they did the same kind of brain imaging here before and after the CBG treatment, you'd see pretty much the same brain image on each side of this. So I think this is really super exciting, because I think what this tells us is that for a long time, people known that CBG has this effect. It reduces anxiety. Now, in a double-blind placebo test, you can tell versus the placebo control group that this does indeed have an effect. So I think this is always exciting to see this kind of data. This is what medical professionals are asking for, right, Dr. T? They'd like to see double-blind studies to know that the actual drug at that dose is actually having the effect. And perhaps medical professionals can now point to this paper around dosing or around giving guidance to patients around, CBG tinctures or other CBG products. But that's my story today. It's Friday. Have a great weekend, folks, and I'd love to hear what my other correspondents have to say. Dr. T, isn't this the kind of thing that well, when I say we, this is the kind of thing that the medical community is really looking for out of researchers like Dr. Russo, who, again, commands a lot of respect. When Ethan publishes a paper, I think the medical community takes a pause and reads that paper.
Well, both the medical community and the cannabis industry. But, this is pharma. Pharma is reconstructing the plant one molecule at a time. What's interesting to me is that there, I don't know any plants. I don't know if you guys have seen any COAs where it's mostly CBG. I've seen, type 1 plants where it's high THC, low CBD, and then maybe about 6% CBG. But I haven't seen it.
There are varieties now, Dr. T, that are high in CBG and low in all the other cannabinoids, in particular low in THC and THCA. So there's the white, I know, is one particular strain that is high in CBG. Oh, it's high in CBGA. It's often very low in THC, so it qualifies as hemp because it's below that 0.3 threshold. And so that smokable flower, Jean, is in shops. And certainly there are tinctures and gummies and other things. I see Vermont Alternative here in the chat was talking about a formulation that was 3 to 2 to 1 CBG to CBD THC, and that formulation does well for sleep aids. So, I think that CBG is certainly gaining its popularity. And one of the reasons, Jean, is because the genetics are now available to create a high CBG variety. So high CBG varieties are out there. That means you can get CBG isolate because that can be isolated from the plant, and also CBGA. I think CBGA is kind of like the 800-pound gorilla in the CBG room, because I think the cannabinoid acids here might have better effect than the decarboxylated cannabinoids, but I see that they can use CBGA in this study.
Calling all
we know
trappers.
CBGA from.
Oh, they did. They did. It was a blend. They actually had a little bit of THC in there too.
Yeah, they did. But what I didn't see in here is whether or not they had CBGA.
Yeah,
But
CBG, GA, and THC, but it was way more CBG than any of the other two. It was just like just a little, like 0.1% or 1%, but not very much of the others.
I would tend to think that you'd want to take a Jean-Luc fire all weapons kind of mentality here and put as many of these cannabinoids into these products. Look for potential synergy between them or efficacy.
This is the value of
the best formulation is again.
Go ahead, Jenny.
It's definitely the value of solvent-based extraction, because you're able to isolate things and kind of honestly reverse engineer a product that adds different cannabinoids in. And I think that this is exciting. I want to hear Dr. Talleyrand's opinion, because I think this is kind of the verifiable proof that doctors are going to need. But I think also, this is my question, I guess. People's bodies do react differently. I saw that you in Vermont Alternatives were going back and forth about how he metabolizes things kind of differently than others then. And that's, I think, so part of the patient frustration when we're looking at cannabis from a medicinal use standpoint, is that it is kind of trial and error based on patient to patient. You kind of have to have a little bit of patience and be willing to kind of go down that rabbit hole a bit.
Yeah, you're right. But you know, that's us still in regular practice. You give somebody a blood pressure medicine, you see if it works, you increase the dose, see if that works, add a second medicine. So we're doing trial and error all the time in the doctor's office.
That's why they call it practice. Who funded this study?
Washington State was one of those, but I don't know who. But yeah, this is a pharma move.
This smells to me like they want to make sure that they can isolate it. It's going to go to Schedule 3. I'm pretty sure this is a play for that molecule for sure right there.
A pharmaceutical company can't patent a public composition like CBG. So while it's true that pharmaceuticals are usually patented compounds that only that company can make, by publishing this literature in the open literature, now anybody can basically say, hey, I want to reduce my anxiety. I'm going to try a high CBG strain. There's nothing a pharmaceutical company.
I don't think the goal would be to get a patent, or the objective. I think the objective would more to get drug preclusion on that compound.
Well, that would require a formulary patent to enforce that. And I think that, that I agree with Dr. Scialdone. And I think that there are formulary patents that exist that contain the aqueous suspension of cannabinoids, and it doesn't say just a specific cannabinoid. And I think that the FDA Preclusionary Act would be something we're looking at with more like the Epidiolex situation.
Well, Ethan is a true soldier of the plant, right? And by Ethan being on this paper and putting it out into the public forum, guess what? It can't be patented now, right? Because it's public information, and public information is prior art.
Nice move.
I love to see people with the right intentions do that. If a pharmaceutical company
wanted to patent this would be ruled as prior art, and the patent would be thrown out.
Well, look at the experience with CBN, and I forgot that company. They created a CBN. They didn't say it was that they were patenting the actual molecule. They're saying they were patenting the process to create their proprietary type of CBN, which they called true CBN. So in some ways, they worked around the whole patent game.
Mm-hmm. See?
Well, you could patent a process, but if you could come up with a different way of making that molecule, how are you going to enforce a patented process if the pharmaceutical company down the road does never let you into their facility to see how they're making it, right? You could test their product and say, hey, there's CBN in the product, but they could claim that they're making it by a different process, right?
Yeah, that's what they did. And then they went to the patent office with that.
Mm-hmm. See? Told you. I knew I smelt it.
Yeah, this one
Smell
is
cooking.
interesting because he added 3 compounds: CBG, CBGA, and THC, and that unique combination, along with any formulation, unique formulation that they're doing, will give them an opportunity to patent this combo.
Yeah, but they could hire someone like me, and I could basically invalidate that patent by just simply finding a strain that has the CBG, CBD, and THC in the same ratio. There'd be prior art to say that that invention is obvious.
Yeah, that's going to be a lot of searching. That's going to be, you can pop in a lot of beans for that, Dr. Mark.
Got to make a living somehow.
Man,
Remember, this didn't have any CBD in there.
Mm-hmm.
It only had CBG.
And I'll tell you what, it's a trapper alert, because apparently CBGA is going to be the next hot thing to sell.
I think so. Yeah.
Mm-hmm. Mm-hmm.